We start with the way forward in the pandemic. Governor Gavin Newsom just spoke about how the state plans to approach the pandemic.
That's right. And this announcement comes nearly 2 years after the first statewide stay-at-home order was imposed.
We have live team coverage tonight. Giacomo Luca spoke to health experts about what moving forward in the pandemic could look like.
But we start with political reporter Morgan Rynor, who has the details on Governor Newsom's new SMART phase of the pandemic.
The big difference is being prepared so that the state can act quickly if there is another surge. That means stockpiles of 1 million of masks, of tests, of ventilators and healthcare workers. But what's just as important as what's changing is what's not changing. And if we do enter another surge, the state can continue implementing whatever mandate or requirement it sees fit.
It's called the off-ramp, on-ramp approach.
While we can't predict the future, we can better prepare for it.
What exactly does the on-ramp look like? If cases and hospitalizations go up, what happens?
If you started to see an outbreak here in and around the region, down the road, or here in Fontana, or down the road, Riverside, anywhere in the county, i.e. all of a sudden, now we've got a team of folks, epidemiologists, Office of Emergency Service, Department of Public Health, whole cross-section of folks in this new unit, and they move in real time.
His plan says for schools to prepare for vaccine requirements regardless and mask mandates when needed. Newsom's plan does not, however, have any metrics that would trigger the on-ramp approach. The plan is supposed to help Californians live with COVID, but part of the message today is not to get too comfortable.
There is no end date, that there is not a moment where we declare victory.
The state is committing resources to help with the on-ramp scenarios, stockpiles of tests and masks.
But also making sure that we are stocked and ready if we see a more virulent mutation of the virus in the future.
In order for the governor to continue implementing whatever mandate or requirement he sees fit, the state needs to be under a state of emergency. But just today, the Senate set a date for the first hearing where they will debate the merits of being under a state of emergency. That's March 15th. And today, a reporter asked Dr. Galley if a decision is made then, well, how will it impact this pandemic phase? And he says that he didn't know the date was set.